Thanks very much, Carol. Thank you all for being here.
So what we've said is that that you can take advantage of the social structure to eliminate the epidemics. So again, we're not saying this is the policy. We're saying this is a way of thinking about how to make policy, a subtle distinction. What the president recommended was that that healthcare providers and emergency workers, 500,000 approximately around the United States, become immunized, and that's similar to our part of our model where we immunize the hospital workers. So in that regard, it's very similar, and we agree that that's a very powerful step in containing an epidemic by itself. The next question is, can you add to that? And the next step that's been proposed by some is mass immunization. We think there's a step short of mass immunization to offer it broadly to the community, that we can get a lot of bang for the buck by immunizing only those individuals who've already been immunized, not by introducing immunization to persons who've never been immunized before. You can get a lot more mileage for the safety of the vaccine by that strategy. So it's not a lot different than the president's recommendation. It just extends it and gives a different idea of how to implement the next phase. On this part of the curve here, you begin to see that some of the epidemics have totally died out, even when only 50 or 60%.
There are isolation strategies, scaling issues. True, it's an 800-person model. It is not clear that it scales up with complete fidelity to the 300 million agent case of the United States, and we don't claim that it does. The idea is to point policymakers in the direction of promising avenues, offer insights that they might not otherwise have, and we think it's successful in doing that. But yeah, there's an issue in whether it scales up. On the question of pathogens, we have been doing, let me just say, the software is designed in such a way to accommodate any pathogen you like. We could do dengue, we could do measles, we could do West Nile, lots of other things. And in fact, our whole idea is to build a laboratory for computational epidemiology in which we can study a huge array of public health questions and pathogens. And in another connection, for one of the working groups of the Academy of Sciences, we've been modeling novel pathogens, genetically modified smallpox. So we're at work on other topics, but today's topic is really the smallpox vaccination issue. It's on the Brookings website, and you can play them. You can develop progressive vaccinia for given other backgrounds. Don, if you wanted to say more about that. All right.
I'd also like to say a word about our two distinguished speakers.